Hi. In this video, I'd like to talk to you about what you need to look out for to make sure your teeth are moving well during your Invisalign treatment. So there are two main things that you need to keep an eye out for. The main thing to look for is how well is the plastic of the aligner fitting around the teeth, and are the aligners moving the teeth where we're expecting the teeth to go. So everything is going well if all of the aligners are snugly fitting around all of the teeth and there are no gaps in the plastic. So this is what we want to be looking out for, gaps in between the plastic of the aligner and the tooth itself. So if you look at the edge of the tooth, at the edge of the biting surface, you'll see that there's the thickness of plastic and then a very, very thin, tiny little space, less than 1 millimeter. That's normal, and it will be that way for most of the teeth. But sometimes certain teeth don't follow where the aligners are trying to push them. This is down to individual physiology, so down to the shape of your roots and how well your body responds to being pushed from the aligner. And it's also probably mostly down to how well you're wearing them, making sure it's a good 22 hours a day and you're wearing the chewies. That's the most important thing. But you want to keep a close eye. Is there any spaces in between the teeth and the aligners? That's what you want to be looking for. The other thing to look for is specific to if you have crowded teeth. So if your teeth are crowded, there's not enough space for them to be straight all by themselves. And what we'll do is some polishing in between the teeth to slenderize the teeth, to make them a little bit thinner so that there is space for them all to fit into position. When this happens, sometimes the teeth can get locked when they're trying to move over each other. As crooked teeth are unraveling and they're trying to slide over each other, sometimes they can get stuck. And so when they are stuck, we call this a contact point. So what we like you to do is to check those contact points with some floss. So using some floss, you put this in between the teeth, and when you slide the floss down, there wants to be no big resistance. There may be a completely open space, or you may feel that the teeth are slightly pushing on the floss, but it's not really clicking through. That's all okay. That means that the teeth have space to move. However, if as you put the floss through a gap, there's a definite click and there's resistance, that's a sign that the teeth are locking together a little bit early and that they won't fully move well. So there will be certain teeth that this will apply to. It won't be all of the teeth, but the most crowded ones, the most ones that need the most unraveling, are the ones that we need to look out for this on. So they'll be the ones that the dentist will do some polishing in between the teeth on, and we'll let you know which teeth to look out for. So any teeth that have a lot of moving to do, a lot of unraveling, check them now and again with the floss to see if you start to get an early click with the floss. So for either of these two conditions, if there's any spaces opening up in between the aligners and the teeth, or if we're getting any early clicking with floss, we want you to get in touch. So please get in touch with our reception and they can guide you through the next steps. Now you can help us decide what to do next if you are able to capture what you've noticed in either a photograph or a short video. So if you can capture what you've noticed, that is really helpful. So please, using your smartphone, take a photograph or a short video, and you can send that to us via email or via our practice WhatsApp. And with that, the dentist will be able to review what's going on, and then we'll be in a better position to guide you on the best next steps.